Welcome, Dr. Tasha Powell. Thank you so much for spending some time talking to us this afternoon. I was really excited to meet you a few weeks ago and find out about the exciting field of preventive neurology. I couldn't think of anybody that I would rather have come and talk to my listeners and followers about the important conditions of Alzheimer's dementia. So I would love it if you would give us some good information, and hopefully we leave with a couple starting points, things to think about or things to do if this is an issue that affects us directly. So my very first question.
Thanks for having me. I appreciate it.
You are so welcome. I think this is going to be the first of many chats we have like this.
Excellent. Happy to be here.
Great. So why don't we just jump right in? When it comes to Alzheimer's dementia, please tell us, who does this affect?
So unfortunately, Alzheimer's dementia is a risk for just about anyone over age 65. It used to be purely something we worry about if you have family history, but now we're finding that many patients without any family history are at risk for developing some sort of neurodegenerative disease, and of course, the most common one being Alzheimer's dementia. In the United States, we estimate over 6 million people have Alzheimer's, and worldwide, it's a pretty heavy burden with over 50 million, if not more. But the unspoken truth of Alzheimer's is that it also impacts the caretakers around our patients. Arguably, that's the bigger burden on our society because you have the spouses, the children, the siblings, the communities that are being impacted by this growing condition in our society.
That's really, it's clearly that maybe we're overlooking or we're not as aware of the impacts on everyone. But hearing those numbers, they're pretty staggering. And this is definitely a significant issue. It's great that we have the chance to talk about it today. Why is it important that we know and talk about it?
Because the truth is, and the data is supporting this on pretty much a daily, weekly basis, we're receiving new data about the capacity for us to potentially prevent or at least delay the disease onset. And this applies probably the most strongly to Alzheimer's dementia and perhaps vascular dementias, because we're finding that they have a strong cardiovascular impact for being a risk factor. So basically, if we're aware of this condition and if we can be motivated to do impact on delaying the onset, then we can apply those lifestyle factors that can help us decrease the disease burden long term.
Great. That's really helpful. Again, anchoring that and how it's relevant to everyone is really helpful. And hearing that there are options for prevention or at least delay of onset is great. I talked to many colleagues who maybe have family members with dementia, and the fear is, when is it going to get me? So knowing that there are things that we can do to improve our and delay or prevent dementia is really helpful and impactful for the patients. So I guess the next question, you've already given us lots of hints, but I guess what I would say is, for everybody, if they say, if this affects me or someone that I know and love, what should I do?
Yes. First off, don't go through this alone. If you're worried about already having symptoms of dementia or cognitive issues, seek out your primary care, and ideally they can send you to a neurologist. Now, there's many wonderful neurologists around the country, but if you have the luxury of having a prevention focus, then you can potentially gain some of these deeper insights that are targeted, individualized to you. But general approach for those who don't have memory issues but are worried about the future, which is basically my favorite patient because I can make the biggest impact, is I would probably break it down into 3 key components. And one has gotten a lot of attention from the many influencers and social media and news. That is muscle mass and cardiovascular strength. So if you have big muscle, literally, the bigger the muscle, the stronger the brain. And if you combine that with some sort of cardiovascular exercise like a brisk walk or a swim or cycle, you're getting the biggest bang for your buck. So much so that if I can put that capacity into a pill, I would probably be the richest person in the world because it's so powerful and potent an impact on preventing or at least delaying the onset of memory issues. So that's one. 2, very close second, I would say it's the nutrition that we consume. And there's a lot of passionate approaches to nutrition. And of course, you have to find what works for you and what works for your conditions that you have, because certain people have conditions like kidney disease or diabetes. And so you can't have a one-size-fits-all approach. But in general, the most studied diet lifestyle that we know of today would be the Mediterranean diet. And Mediterranean diet is not a complex multi-course meal diet. All it means is consume a large diversity of fresh vegetables and fruits, nuts and seeds, legumes, and try to replace as many of your fat needs with olive oil if you can. And so diversity over intensity. Some people can come to me and say, but doc, I eat vegetables every day. I eat my broccoli every day. Broccoli is wonderful, but you have to have diversity. So adding various culinary herbs, adding various fruits, focusing on what they say the colors of the rainbow can be really helpful for getting that dietary component. And an extra bonus, and this is something I feel like we don't talk about enough, and there's not enough data to suggest this as an intervention, but I feel very strongly about it, and that would be the fermented foods, helping a lot of our neurologic conditions start from the gut. So optimizing the gut in a world where we have so many clean, sterile, and waxed foods, it would be nice to add that extra diversity through eating fermented foods. And then finally, third, this is, some would argue, probably just as important as the first two, because if you do the first two, which is the exercise and strength and the dietary, without doing this third one, you're missing that strong, important aspect of life. And that is living with intention, meaning, purpose. And because we're creatures, intention, meaning, and purpose, usually for most of us, it means having strong, close social ties with your family, community, your network of friends, or a church, or a book club, or whatever your interests and hobbies are, but ensuring that you age with having those people around you. Now, of course, there's a subset of us that might be introverted and they don't need as many social connections, but arguably, even for those people, as we age, we need to have a sense of meaning for your existence. So you don't have to be as social, but you could be contributing in some meaningful way to your community that might not have to involve being around a lot of people all the time. But I would say those are the three hallmarks. We've learned those. There's not many randomized controlled clinical trials for each one of those, except maybe for the Mediterranean diet. But we've learned about those from these blue zone areas around the world where people tend to live longer, happier, and healthier. So looking back at these epidemiologic data, we can see that those three are important.
That's great. Thank you so much. That's really valuable information. I always appreciate the opportunity to talk about prevention. So much of the medical model involves treating things after they happen, as you and I've discussed before. And I think we can empower patients to be successful in the treatment regimens that we have for them, but how much more empowering to give them a chance to avoid or delay what can be really debilitating chronic illnesses. So I really appreciate your insight and the great tips you have given us so far today. Any last thoughts?
Actually, my last thought is going to touch upon what you just said, and you hit the nail on the head, and that is the power of empowering our patients and people around us, our community, to make those changes themselves. We're both doctors, MD, I believe 100% of my medications. Heck, about 45% of the medicines we have in the market today are derived in some way or form from plants around us. So we have to recognize that also medicine is around us in nature. But when you empower patients and our population to believe that, and then have some kind of a control into what they consume and what kind of lifestyle they live, and knowing that that can impact their health, I think that in itself can give you a therapeutic sense. So you have this benefit from the biochemical sense of getting these big muscle and better connections in the brain and eating the right foods that may optimize your mitochondrial function. But then something about that, perhaps a placebo effect of knowing I'm doing something for my health that actually translates into big actionable outcomes for a patient and for our society.
Great. Well, thank you so very much for making time to chat with us today. And thank you for giving us really actionable tips. And I think it's always important just for us to be very aware that even if something doesn't directly affect you, understanding at least a little bit about it gives you a greater understanding of family, friends, colleagues, the community around you, and gives you a chance to live more intentionally as well. But thank you again. I appreciate your time, and we'll look forward to seeing you here again.
Doc Kumi, thanks for having me. I'm happy to chat anytime. As you know, I'm very passionate about this, and I've been known to empower people whether they want it or not.
Oh, well, no, that's great. We will definitely be coming back again soon. I was really impressed by your passionate enthusiasm and how knowledgeable you were when I met you. So again, I'm glad that you were able to be here today, and we look forward to having more chances to hear from you in the future. So
Anytime.
we'll sign off for now. Thanks, everybody. We'll see you on the next video.